Hi, if you're one that suffers from vertigo, dizziness, lightheadedness, or even giddiness, I'm hoping that this technique that we're about to go over together is going to make a big change in your life. Dizziness, vertigo, usually is benign, but I highly recommend everyone out there, if you're having constant vertigo, dizziness, and you feel if something is not right, get it checked out by a specialist. Fortunately, the majority of all these conditions are going to be benign, and they're really not going to be able to help you, but give you drugs and medication. Realize that drugs and medication have side effects. I prefer you try to do things naturally and allow the body to work naturally and heal naturally before these side effects make problems worse. These are meridians. These are self-help acupressure meridians that you're going to do on your own body to restore and allow those meridians to flow properly. Realize that meridian therapy from ancient medicine, from thousands of years ago, is all about balance. Meridians are throughout your entire body, and by stimulating certain points, you are then allowing the body to heal and repair the way it's designed to heal. One of the major points is called the third eye. This is a universal point, and the point is on the top of the bridge of the nose as it comes up and as it meets the bottom of the forehead, right between the eyebrows. That is the third eye. You're going to take your thumb and you're going to hold that point about 2 minutes, and now you're going to apply constant pressure to that point for approximately 2 minutes. And as you hold that point, you may feel some different neurological changes. You may feel fullness in the sinuses. You may feel a release of pressure in your neck. And you may even feel a release of the giddiness, the dizziness, the lightheadedness, or even the vertigo that you may be experiencing. The third eye point, when you hold it after 2 minutes, if you notice that you're still symptomatic, that you're still experiencing some of those dizzy feeling or vertigo feeling, you can do this several times a day. You may want to wait a few hours because it's a very powerful point, and the key here is to stimulate those meridians so the body can heal and function naturally. The other amazing acupressure point is Pericardium 6. They call it P6. And the way you find this is if you take your wrist and you bend it back and forth, you'll see a crease. And that crease that bends back and forth is your landmark. You're going to take 2 fingers, your second and third finger, and you're going to put it right at that crease. And you're going to imagine half of the other finger right below this finger, because you're not going to do 3 fingers, you're going to do 2.5 fingers. If you go 1, 2, and half of this, and you come down right in the middle of the forearm, you'll feel 2 tendons. It feels like 2 pieces of rope. You're going to push on that point right between those 2 tendons, 2.5 finger lengths, right below that crease, and that would be P6. You're going to hold this point for 1 to 2 minutes and just apply constant pressure. And as you hold the point, you will feel a release of that dizziness, that lightheadedness. You'll feel that vertigo hopefully will start to settle down. This actually helps anxiety and nervousness, a fascinating point for that as well. So hold that point 1 to 2 minutes, and you can do both arms, both wrists, because that would only actually help accelerate the condition. So from getting up out of bed, moving your head from side to side, changing positions, and just feeling that vertigo, that spinning going on in your head. Yes, it's happening in your head because it's not happening anywhere else. And obviously, the most important thing from the dizziness, the lightheadedness, the vertigo, the anxiety, they all go hand in hand. So stimulate those points. You can stimulate both points of P6 in both wrists, 1 to 2 minutes. You can do that several times a day. And if you continue to feel these symptoms, you'll use that technique a little bit more. But as these symptoms diminish, you can start diminishing, stimulating those points as well. Now realize, anything too much can cause side effects as well. So if you're stimulating the point too much and you're feeling worse or you're not feeling better, then you need to back off. You need to listen to your body and make sure that when you stimulate these points, do not hurt yourself, do not push too hard, because you should not be sore by stimulating these involved regions. If you have questions or comments, write them below. Pass this video on, I appreciate it. And again, anything that I can help you with, feel free to put your comments below. And most important, make it a great day. I'm Dr. Alan Mandell.